Swati Naik and you are watching us live on MQL AISUG TV from Bhubaneswar. I am pleased to have with me Dr. Sukanta Mishra. He is a professor and head of the department at Vivekananda Institute of Medical Sciences, Kolkata. Thank you so much, sir, for joining us. We are going to have a conversation with you on the topic of non-descent hysterectomy, vaginal hysterectomy. Sir, would you like to define this non-descent vaginal hysterectomy? And in what percentage of patients do you perform this procedure?
To define non-descent vaginal hysterectomy, I need to go back to history a little bit. Like the first hysterectomy was done about 200 years back, the year 1813, by Conrad Lange. And it was on the vagina. Subsequently, it was taken over by the general surgeons and the uterus was taken out from the abdominal cavity by making an incision. And then known as abdominal hysterectomy. Then of course, right came with this natural graft, this is laparoscopy. And the laparoscopists took over, they started doing hysterectomy by taking the head of the laparoscope and taking out the uterus vagina. And that's how the procedure continued. Now, if you look carefully, that vaginal hysterectomy means when it is removed through vagina. When there is prolapse of the uterus, it is coming out naturally. It is very easy for anybody to take out the uterus vagina. But when there is no prolapse whatsoever, to take out the uterus vagina seems to be apparently difficult. But over the years, it is proved that it is not a difficult procedure. In fact, it has many advantages compared to other methods, and that is the best method. I would say, over the years, I have tried, and there are many scholars in our country also. They have proved it across the globe that this is probably the best method, even when there is no descent of uterus at all. That is what is called non-descent vaginal hysterectomy or NDH.
Era of laparoscopy being so boomed and practiced every now and then, are there any specific indications for such kind of hysterectomy?
That's a very good question. In fact, most of the hysterectomies can be done by any route. You can do it through the abdominal route, you can do it through laparoscopy, and you can do it through the vaginal route. But the best route of these is the vaginal route. Because you are taking out the uterus through no hole. And in laparoscopy, you are making 4 or 5 holes. So you can say keyhole surgery, but this is no hole surgery. That is the beauty. No hole hysterectomy, no incision whatsoever. The patient cannot feel, no pain, recovery is fast, can join duty as early as 7 days, less bleeding, less anesthesia, and in our country, this is less expensive also. So, less pain, less morbidity, less bleeding, can go back to work as early as 7 days, and less expensive. All these are advantages for doing non-descent vaginal hysterectomy.
Thank you so much, sir, for joining us for this. But in the end, would you like to give a key message for this non-hole vaginal hysterectomy to our patients?
Yes, in continuation of what I was saying, that not that all the hysterectomies could be done vaginally. There are cases like the cases adnexal masses, and few other difficult cases are there where you cannot do non-descent vaginal hysterectomy. If you look back the situations when we do hysterectomy, these difficult situations comprise say about 10%. So in 90% cases, hysterectomies can be done. Initially, those who are not used to it, they can start doing it and practice it under guidance of senior teacher to do it. And in 60 to 70% cases, with a little bit of training, anybody can do that. With better training and advanced skill, probably you can increase the number to 75%, 80%, and maybe more than that. So at least 80% of the hysterectomies in our country can be done with this. Patients will be benefited, society will be benefited.
Right. So in the scenario of economic constraints, definitely the non-hole vaginal hysterectomy stands its own place. The only thing is one need to take care of is the best skill and the
training.
Thank you so much, sir, for joining us.
Yes. If you consider uterus as a holy head and abdominal cavity as a root, how can you take it out? Breaking the abdominal wall or making multiple original, or thinking of natural.
Perfect. Very well said, sir.
So
That gives us a changing concept. Yet old is gold. In that,
old wine and new wine. It was there. In fact, this concept is being revived, and everybody is trying to accept this concept. This is new. In that.
so in that
Yes.
respect, so
Not that.
old wine and
The idea was there, surgeons were there. Somehow,
we got skewed for that.
few to us laparoscopy and things like that. Laparoscopy are good. Of course, there are some situations. And even in my mind, there are some situations where you can take help of laparoscopy and then go for that. So that's also important.
Thank you so much, sir. Thank you for sharing your views.